Hello, my name is Stephanie Cortez, and the policy that I chose to discuss is emergency care for individuals experiencing symptoms of opioid overdose. According to the Montgomery County Public Schools website, the purpose of this policy is to establish procedures to provide emergency medical care to any individual experiencing symptoms of or reasonably believed to be suffering from a possible opioid overdose, including the administration of opioid reversal medications. The purpose of this policy is also to establish procedures for MCPS to obtain and store naloxone or other opioid overdose reversal medication, and to train and authorize certain persons to administer it to students or other individuals on MCPS property. From a historical perspective, we understand that the opioid epidemic has formally been declared a public health emergency nationwide as of October of 2017. Fentanyl is increasingly being found in the illicit drug supply across the country, where it is often added to or replaced for other opioids such as heroin. In a memorandum that was published in February of this year, the Education and Culture Committee, Health and Human Services Committee, as well as the Public Safety Committee came together to provide an overview of the county's current opioid and fentanyl response. According to this memorandum, fentanyl usage and overdoses have become a growing problem among our youth in the county in the last 2 years. Data shared by MCPD shows youth overdoses spiked in 2022, rising approximately 77%. There were 48 youth overdoses last year, 11 of which were fatal. In 2021, there were 27 reported youth overdoses, 5 of which were fatal. Some of the strengths seen in this policy are the training. So, for example, all MCPS school staff are required to complete the opioid awareness and response training manually. Principals must identify 3 school-based employees who receive additional hands-on formal training. There is also an employee agreement to be trained on administering naloxone. Finally, being trained in identifying symptoms. I believe this policy is strong, and it is effective in ensuring that all responsible stakeholders are properly trained. In terms of weakness, due to the rise in opioid overdoses, it would be prudent to have all staff members receive hands-on training. This policy directly affects schools because it provides proper training for staff. It raises awareness on how to spot someone who could potentially be intoxicated and or experiencing an overdose, and it is a life-saving policy that ensures the safety of our students. Beyond the aforementioned impacts, the Maryland Opioid Operational Command Center, otherwise known as the OOCC, have identified some strategies that can impact not just our students, but our community as a whole, with a focus on prevention and education. The primary strategy aims to reduce individual and environmental risk factors while increasing protective factors to prevent or delay the onset of drug use. An example would be lessons in class that address the risk associated with substance use. The secondary prevention strategy includes harm reduction efforts, aims to meet drug users where they are by offering a multitude of services, and provides an opportunity for individuals who use drugs to engage with systems of care in a dignified manner.